Hello everyone, my name is Howard Bryant and welcome to my PSA presentation on opioid use disorder. So you may ask yourself, what is opioid use disorder? Opioid use disorder is the misuse of prescribed opioid medications, use of diverted opioid medications, or use of illegally obtained heroin. Opioid use disorder is typically a chronic relapsing illness associated with significantly increased rates of morbidity and mortality. Opioid use disorder is a diagnosis that was first included in the 5th edition of the DSM in 2013. So, in order to fully understand opioid use disorder, you need to know what opioids are. So what are opioids? Opioids are meant to be used to treat pain, like in recovering from an injury or post-surgery. They are chemicals that cooperate with the opioid receptors in the nerve cells of your body to lower the feelings of pain. Opioids are a class of drugs which includes the prescription pain relievers, synthetic opioids, and heroin. Now let me give you some statistical information about opioids and opioid use disorder. About 21 to 29% of patients prescribed with opioids for chronic pain misuse them. Between 8 and 12% of people using an opioid for chronic pain develop an opioid use disorder. In 2019, over 1.6 million people were diagnosed with opioid use disorder in the U.S. alone. Also in 2019, nearly 50,000 people in the U.S. died from opioid overdoses. The Centers for Disease Control and Prevention estimates that the total economic burden of prescription opioid misuse alone in the U.S. is $78.5 billion per year. And if you look at the graphic to the left, from about 1999 to 2019, nearly 500,000 people died from an opioid overdose. Now, you may ask yourself, how can I tell if someone has opioid use disorder, or what are the symptoms of opioid use disorder? Well, according to the graphic here, there are about 10 defining symptoms of opioid use disorder, but I'm only going to mention the 3 most common symptoms, which are number 1, taking larger amounts or taking opioids over a longer period than intended. Number 2, spending a great deal of time obtaining or using the opioid or recovering from its effects. And number 3, craving or a strong desire or urge to use opioids. So, what are the treatment options for opioid use disorder? The most common treatment option for opioid use disorder are the 3 FDA-approved medications, which are methadone, buprenorphine, and naltrexone. Methadone was approved in 1947, buprenorphine was approved in 2002, and naltrexone was approved in 2010. Other treatment options include cognitive behavioral therapy and dialectical behavior therapy. So what is my overall message for people with opioid use disorder? Opioid use disorder can be a tough and debilitating disorder for millions of Americans every year and can have a substantial impact on the quality of life for those who have this disorder. But there are reliable treatment options for opioid use disorder. Even if the medications of methadone, buprenorphine, and naltrexone do not help one find relief and achieve recovery from opioid use disorder, there is always the effective treatments of cognitive behavioral therapy and dialectical behavior therapy. So overall, if you, a friend, or a loved one are diagnosed with opioid use disorder, do not be afraid of this disorder because there are many reliable treatment options that help deal with and treat this disorder. And that is the end of my presentation. Thank you and have a very good day.